Chronic pancreatitis causes progressive, irreversible destruction of pancreas. It is due to high alcohol intake and biliary tract disease, but this is not always the case. Other less common causes are medications, elevated triglycerides, some autoimmune conditions, some inherited or genetic conditions. In some people, the cause of chronic pancreatitis is never discovered and remains a mystery. Most common type is chronic calcifying pancreatitis. Less common type is chronic obstructive pancreatitis. Here is normal pancreas with normal parenchymal ecotexture. Pancreatic duct is seen normal. Chronic pancreatitis causes changes in the size and echo pattern of the pancreas. Here, pancreas is small in size and rarely visible pancreatic parenchyma. We can see calcifications and pancreatic duct dilation. In case of chronic pancreatitis, ecotexture of pancreas is usually a mixture of hypoechoic and hyperechoic foci. Hyperechoic foci caused by combination of fibrosis and calcification. Hypoechoic areas likely due to associated inflammation. It is difficult to differentiate between chronic pancreatitis and pancreatic carcinoma in a patient presenting with dilated pancreatic duct. As a general rule, chronic pancreatitis is more highly suspected when the duct contains calcifications. Here, pancreatic duct is seen dilated and irregular. Liver is normal in size with normal hepatic parenchyma. Eye sphere is not dilated. Spleen is normal in size. Here is the common bile duct, is not dilated. Gallbladder is normal. Lumen is free. Here color Doppler shows surrounding vascularity of the pancreas. So, this is a case of chronic calcifying pancreatitis.